kwa sababu labda muda mwingi tumetumia kuongea mambo si muhimu. Mambo wale wauguzi ambao wako frontline waweze kuwekwa quarantine. Na wao wakipimwa pata siku 14 kuona kwamba hali yao iko nzuri ama wamepata maambukizi, wote ambao wako katika frontline, wale wako isolation na wale wako casualty department. Kwa hivyo hayo ndio mambo ambayo sisi tunataka wao wanachunguzwa pata siku 14 na wawekwe quarantine.
Na shukrani sana Seth Panyako na Peter Washira kwa kuweza tu kuzungumza nasi na kuweza kuweka wazi swala hili kuhusiana na wahudumu wa afya katika vita dhidi ya virusi vya corona. Mtazamaji, ni hayo tu kwa sasa. Kwa wote waliochangia katika mjadala huu, shukrani sana, na kwa wote waliofanikisha NTV sasa, shukrani sana mtazamaji. Ni hayo tu kwa sasa. Kwa niaba ya Salim Swale, naitwa Nuru Abdul Aziz. Uwe na mchana mwema.
Sensitivity is a short, sharp pain that people experience when they have something hot or cold getting to the nerve of the tooth. Dentists recommend Sensodyne to their patients. It's able to get inside the tooth and calm the nerve of the tooth down. And the proof's in the results. It works.
Looking to enjoy sumptuous meals and office deliveries. For inquiries or to place an order, call 0700-613-902 or email info@nascos.co.ke. Nation Staff Consumer Society Limited. Enjoy our hospitality.
Kiprop is going to make it. He's got another 20 yards to go with those long legs.
A three-time world champion and a former Olympic champion in the 1500 meters, Asbel Kiprop was a global sporting icon.
Seeing your friends shy away, some you mentored them, some you competed with them.
His world came crashing down on him.
Even my own wife then did not know, what I'm going through. And she went away. I remember this is the marriage I built through athletics.
Kiprop is still protesting his innocence. Join Grace Musalame this Saturday from 8 p.m. on Unscripted with Grace, only on NTV.
My name is Eliud Kipchoge. I would like to take this opportunity to wish all my fellow Kenyans peace and safety during these difficult times as we fight the coronavirus pandemic. Take the necessary precautions to keep yourself and your family safe. To my fellow athletes, please train in isolation and take necessary precautions. We shall overcome this pandemic. May God bless you and God bless Kenya.
Jonah is terminal. It's his dying wish to see his father on top again.
There's an operation that can save Jonah, and I need the money. Let's call it a new beginning. A race, to be exact.
It was his idea, the whole thing. He's got a real creative mind.
Who will I be racing against?
Know who? It's called geocaching, Reese. It's real good fun.
You are lost.
And the course?
Ohio.
Heaviness and a burning inside. It could be heartburn.
Indigestion and heartburn? Eno gets to work in 6 seconds and works on the 6 symptoms of heartburn so you can keep living life non-stop. Eno, fight heartburn and indigestion fast.
Na wewe unamjuaje?
I was his fiance.
Shika storo kibao na 200% storo bonus. Piga simu zaidi, tuma SMS au nunua bundles ufikishe target yako leo. Isitoshe, pata 50% extra airtime unapotop up na kupiga *544*2* amount hash. Safaricom, for you.
Protect yourself against coronavirus by using Amara antibacterial hand sanitizer that will effectively clean your hands and eliminate disease-causing virus while you're on the go. In line with government regulations against traders hiking the price of hand sanitizers, report any trader selling out of the below prices to 020-864-2330 or 020-864-2333. Usingoje hadi dakika ya mwisho. Pimwa kwenye hospitali ya serikali. Matibabu inapatikana bila malipo. TB inakinga na tiba.
We have come from far with you. I even gifted you a magnificent house. Rosa, it's the thought that counts. Please help me.
When it comes to fever, you need to be both. Panadol Baby and Infant starts to work on fever in 15 minutes and is gentle on the tummy. Panadol Baby and Infant, tough on fever, gentle on your child.
Sonadol Extra imetengenezwa kwa njia spesheli kupambana haraka na maumivu ya kichwa, mwili na hata meno. Sonadol Extra, hakika maumivu yakizidi, pata ushauri wa daktari.
PesaLink is the cheapest way to send and receive money instantly into your bank account anytime, anywhere. Use PesaLink today in 3 easy steps. Step 1. Select PesaLink on your bank app or USSD. Step 2. Select either send to phone or send to account. Step 3. Input the phone number or account number to send money to and confirm the transaction. PesaLink. Easy, affordable, instant.
Working from home? No problem. Fiber Home has you covered with the fastest and most reliable internet speeds. Get connected today. Kazi lazima iendelee.
Usingoje hadi dakika ya mwisho. Pimwa kwenye hospitali ya serikali. Matibabu inapatikana bila malipo. TB inakinga na tiba.
This is NTV.
Good afternoon, my name is Olive Burrows and you're watching NTV at 1. Brenda and Brian, the index patient and her first contact respectively, made their first public appearance this afternoon as the recovered patients in a live call with President Uhuru Kenyatta. They've urged Kenyans to stop the spread of the coronavirus. The two are the latest in the Kenyan tally in the number of recovered patients, totaling 3. Here's that story.
So indeed, We are celebrating today despite the challenges that we continue to face, your bravery. But more importantly, your patriotism in recognizing that you had a responsibility not just to yourself, but to your country, to your neighbors, to your family, to your friends. As a result of that, you were able to limit your contacts with other people. You were able to identify the people who inadvertently you had been in contact with, who were able to trace. And there is not one single death that can be attributed from your infection. You're a very brave and wonderful girl, Brenda, and we celebrate you for that, and we are grateful to you.
I think I may have contracted the virus in London or on the plane back to Nairobi. So after landing in the country, I had a cough 3 days into landing in the country. So when I suspected they might have been something, as a responsible Kenyan citizen and a patriotic Kenyan, I decided to watch the response of my body for 1 day. And then the next day, that is when I presented myself to Mbagathi Hospital, because I saw on when I was in the US, I had seen something about Mbagathi Hospital having an isolation center. That's why I went to Mbagathi. So I think that was very useful, the information I saw, because at least it helped me know where to start. Because the nurses were also, I think they were also, you know, under some pressure because it's the first patient, they have not seen this before, but they were really nice, they were very supportive, the doctors as well, and the cleaners who came to clean my room. They used to talk to me a lot because sometimes I was very emotional, but I would like to assure everyone, all the Kenyans, that this is something that can be managed. It's treatable, and sometimes you may show very, very mild symptoms, just a cough and a headache, but when you see that, you're supposed you know, as a responsible Kenyan citizen, you should contact the authorities and tell them, I'm not feeling well, this is how I'm feeling, and be, you know, come forward and be confident, because they're going to treat you and they're going to do everything for you.
I got the virus from contact with Brenda over here. I got it from the community transmission, what the ministry is calling that. So immediately, Brenda's results came back. I'd like to thank the government, your government, because they reacted very fast. They came for me wherever I was. They took me to a government facility, and I was tested, and immediately the results came back as positive. The government, your government again, embarked on treating me for the past 2 weeks or so. And as a result of that treatment, I've recovered. I'm feeling much, much better now, like I was before.
2 bees in a pod to borrow a quip made by Dan number 8. I wonder if they're dating. Well, with 49 African countries currently with recorded cases, governments continue to roll out increasingly robust measures to halt the spread and to contain the coronavirus pandemic, which has claimed a number of lives. Dozens of countries across the continent have also imposed restrictions, from nighttime curfews to total shutdowns, as they try to halt the disease. Let's get the details.
Africa's largest city, Lagos, appeared deserted after Nigeria locked down its economic hub and shuttered its capital in the continent's latest effort to break the juggernaut of coronavirus. Businesses were closed, markets abandoned, and streets empty at the usually chaotic megacity of 20 million people. Police in protective equipment manned checkpoints, trucks carrying non-essential items were turned back, and youths were spotted playing football on a usually traffic-clogged highway.
We saw here is more than 60, 70. They started running through the back door, and we are not able to get hold of any one of them. But as a result of this now, we have decided now to shut it down, because the governor directive is that everybody should stay at home.
Officials insist that draconian measures are needed urgently to ward off an explosion in infections that could swamp the weak health system in Africa's most populous nation. Uganda currently has 44 confirmed coronavirus cases, 0 deaths and no recoveries. President Yoweri Museveni ordered a 14-day nationwide lockdown in a bid to curb the spread of the virus. He ordered the closure of all shopping malls, hardware shops and businesses selling non-food items for 14 days. Across all of Africa, countries have recorded more than 5,700 cases and 190 deaths, according to the World Health Organization. The numbers have lagged behind those of other countries, and there are still a handful of countries that had yet to detect a single case. Tanzania, Botswana and Mauritania on Tuesday became the latest nations to register fatalities, while Sierra Leone reported its first case. Burundi has confirmed its first 2 coronavirus cases, according to the Ministry of Health. The 2 patients are Burundians aged 56 and 42. They had traveled to Rwanda and Dubai respectively. Burundi suspended all flights and started screening returnees and visitors from countries affected by COVID-19. Ethiopia postponed general elections due on August 29th owing to the outbreak and said a new date would be given when the pandemic is over. In Central African Republic, a country ravaged by years of fighting, there are only 3 respiratory ventilators for a population of 4.7 million, the Norwegian Refugee Council said. Guinea President Alpha Conde ordered a nighttime curfew in a country already mired in political crisis over suspicions its leader is trying to cling to power. Oil-rich Angola saw strict restrictions imposed since Monday. Experts have repeatedly warned of Africa's vulnerability, describing its many conflicts, poor sanitation, packed urban slums and under-equipped hospitals as sources of potential catastrophe. Growing reports of brutality from security forces in some nations have highlighted the challenges of enforcing curbs on movement. The police watchdog in South Africa, on lockdown since last week, said Monday it was investigating an officer for allegedly killing a man who defied the regulations.
The Kenya Red Cross and the International Committee of the Red Cross are working with the Kenya Prison Service to fortify prison facilities across the country from the threat of COVID-19. 48 men's, women's and juvenile prisons are being reached by the effort, which includes setting up hand washing stations and providing soap and disinfectant gel, as well as health education to inmates about COVID-19. Prison staff also being trained in COVID-19 prevention, symptoms and what to do if someone is sick. The ICRC is also working with the Medical Directorate of the Kenya Prison Services to establish medical protocols for COVID-19 in prisons. This includes infection prevention measures at the entrance, and that means hand washing and temperature checks, as well as procedures to be taken if an inmate is sick and needs to be transported to a hospital.
So it's the first batch. Of course, we realized by working together there is a need to really increase the number of screening points, and so we'll be happy at the International Committee of the Red Cross to further support the Kenya Prison Service with the needy construction protective material for doing so.
We have done a lot of work in the prisons around the country, especially in terms of sensitization and trainings for the prison staff and also the inmates, provision of hand washing facilities and including soap.
Well, speaking of COVID-19, we are now joined by the CEO of the Africa Risk Capacity Insurance Company, Leslie Ndlovu. Leslie, happy to have you on NTV this afternoon. You are to roll out an insurance, or rather the ARC is an agency of the African Union. Let's just make that clear. And you are to roll out a product this year as far as outbreaks and epidemics are concerned. Have you rolled out that insurance product?
So good afternoon to you, Olive, and good afternoon, viewers. Indeed, we were looking to roll out an outbreak and epidemics product this year. The product would have covered Ebola, Lassa, Marburg, and meningitis, because these were the outbreaks that we had seen previously in Africa. However, just given the profound impact that the coronavirus has had, we will also be looking to roll out a coronavirus product. The way the insurance product would work is at a national level, and it would transfer some of the risk of the cost of response from the government to the international insurance and reinsurance markets.
Okay, now what would that mean in terms of once countries report the first cases of infections such as corona? What does that mean in terms of tracing, having access to that financing? What does it mean when it comes to tracing contacts and also testing? Will it bolster their capabilities?
So it definitely would bolster their capabilities because the product would work along two dimensions. The first dimension is that we would work very closely with the country to help them develop a more effective disaster response and management system, and to have in place a contingency plan in case an outbreak happens. And then also we would, through insurance, very quickly pay out any claims to give the government adequate means to be able to respond. We would, in conjunction with the government, agree on what the modeled cost of response would be, and the insurance payout will be calibrated based on the expected cost of the response.
Okay, what role is ARC playing in the present situation as far as the coronavirus is concerned?
We are playing an extremely important role because we had developed modeling capabilities on the spread of the infections and the cost of the response. While our models were not originally designed for coronavirus, as I initially mentioned, we have managed to adapt them, and we are sharing this information with governments to help them in the response. Secondly, we are in contact with a number of African countries since we have a Pan-African mandate, and this enables us to share best practices across the countries. And we will, going forward, also help strengthen the response capabilities of the countries, and to ensure that there is adequate planning in place, so that essentially when an outbreak happens, the country is very well prepared to tackle it.
Okay, and why is it important to coordinate Africa's efforts against COVID-19?
So fundamentally, I think there's a lot that we can learn from each other, and then this allows us to deploy the best practices across the entire continent. And secondly, there is a great deal of travel in between African countries. So the countries need to work in a coordinated fashion to ensure that it doesn't spill over the borders.
All right. And finally, what lessons did we take away from Ebola? You also mentioned the Marburg virus. What lessons did we take away from those two scenarios that can apply here?
The most important lesson in epidemics is always the speed of response. And I have to say that I've been heartened by the measures that have been taken across the African countries in terms of instituting restrictions in movement, because this is really what is required to fight the epidemic. I think the level of public education has generally been good across the continent, and this is something that we have learned from fighting the various outbreaks of Ebola we've had on the continent.
Okay, how will you determine once the product rolls out, the O&E product rolls out, how will you determine how much each country is qualifies for?
So this is a decision that has to be taken by the country. Of course, we work very closely with the country to advise them in terms of what their potential exposure is, and then the country will decide how much of the risk they would like to retain and be able to pay from the normal budget process, and how much of that they want to transfer to us in terms of the insurance product. So it is not something that we impose top down on a country, but it is more the result of a dialogue between us and the country, working together to understand what their constraints are, and ultimately come to a decision that makes the most sense for both the country and ourselves.
Okay, thank you so much. Leslie Ndlovu, he is the CEO of the ARC, and that is the African Risk Capacity Insurance Company. He's briefing us on the ARC's response to COVID-19 on the continent and what potential there is in terms of safeguarding our economies and our responses in future to similar outbreaks. And now the Coast Regional Police Boss, Rashid Yakub, has touched the hearts of many after helping a woman who was wearing a plastic bottle as a face mask in Likoni, Mombasa. The woman and her 2 children were waiting for the ferry from the island on Wednesday evening, and because they didn't have masks, they fashioned some out of plastic bottles they had. The police boss saw the family without masks and bought them some. Kevin Mutai from Mombasa has the story.
A quote by Norman Schwarzkopf says, "It doesn't take a hero to order men into battle. It takes a hero to be one of those men who goes into battle." Those words reflects the efforts done by exemplary men and women in uniform during battle, an example of even now when the country is battling with the deadly coronavirus. Police officers have been on the battlefront in enforcing the COVID-19 protocols, some even putting their lives in harm's way. But this picture of a woman using plastic bottles together with her 2 children as masks at the ferry crossing channel in Mombasa caught the attention of the regional police commander Rashid Yakub. Yakub bought the woman and her children the masks and even gave her some money and a bottle of sanitizer.
Ukiambiwa panga laini usione ati kuna agenda fulani. Tunajali maslahi yako kama mwananchi wa kawaida, mwananchi wetu, na vile jali maslahi yetu sisi kama polisi.
Police have been enforcing the social distancing guideline at the channel, as well as urging commuters to put on their masks or even have pieces of cloth to cover their mouths. They have been experiencing challenges in implementing some of the drastic measures, but they have remained steadfast, maintaining that even more stringent guidelines are required to keep the virus at bay.
The only way we can break the particular chain of the disease is staying home. Certain situations are inevitable. People still have to go and look for work, but we still insist the most important thing is people to stay home.
The authorities are also putting in place mechanisms and developing frameworks that will help the most vulnerable in society if the government decides to lock down the country.
We've already considered facilities around. If we have to go to that situation, I believe we're prepared for it, and perhaps we're working towards that particular direction as a team. Once that comes in, although at the moment there's no indication of that sort, but if that becomes necessary to go into it, I believe we're prepared.
Kenya has 59 positive cases for COVID-19, of which more than 10 are from the coast region. This calls for a united approach to stop the spread of the virus, which has killed 1 person in the country and thousands others globally. Kevin Mutai, NTV, Mombasa.
West Pokot County government has rolled out a free seeds distribution program through the Ministry of Agriculture. 9,877 bales of certified maize seed worth 40 million shillings will be shared out, and it's expected that it will benefit more than 500,000 people at risk of facing hunger. Speaking during the launch of the program in Kapenguria, the governor, John Lonyangapuo, directed residents to invest in farming now so that by the end of the year there is enough food in the county. Lonyangapuo also urged residents that the time they spend working in their farms saves them from interacting with different people, and so they'll be safe from contracting the coronavirus. The maize seeds will be distributed to villages in 20 wards, where every farmer will get 2 packets of 2 kilograms to be planted on half an acre.
Sio kila mtu atapata mbegu. Wakulima ni wengi. Wale watapata mbegu labda hawatafikia ile namba ya kila mkulima. Tumekusudia kupatia wakulima wale hawana uwezo, kuanzia na wale wajane, wale widows ndio wa kwanza, wa pili wazee elderly. Bora sharti ya kwanza lazima uwe na shamba. Kama kuna vijana pia wako na shamba na wanataka kulima, watapewa mbegu. Awalabu pia wale wako na disability mbalimbali, bora tu mradi awe na shamba.
Tusipopanga maisha yetu tutapangwa na shida ya ulimwengu ya njaa, especially na West Pokot imekuwa ikilishwa kila mwaka tangu 1963 siku za mabeberu. relief food. Mwaka mbili tu zilizopita wakati tuliingia uongozi, ndio tumekuwa na hii program ya kupeana mbegu ya kutosha nusu eka ama eka moja.
As the risk of COVID-19 grows and awareness is being increased, the demand for protective gear is also rising and thereby creating opportunities for improvisation. Our reporter Gabriel Kudaka caught up with a tailor in Uasin Gishu County who is making reusable masks in a bid to mitigate the spread.
At the Eldoret Central Business District in the county of Uasin Gishu, we find Richard Rotara going about his business. He has responded to a need created by the COVID-19 pandemic. He is making reusable masks.
Ilikuwa inauza 10 bob. Wakati nilienda kuuliza bei, wakati nilienda mochari nikapata naambiwa 70 bob. So hiyo kitu ikaniuma sana. So nikafikiria kulingana na vile president wetu alisema tukie na nini ya kukifikiria jinsi ya kutengeneza local masks.
And with that challenge, Rotara embarked on producing what he terms as lasting and affordable masks.
Hii mask ni mzuri sana. Hii ukinunua mbili, unaweza tumia tangu asubuhi mpaka saa 6, unaifua. Tena utakuja kutumia. Alafu ile nyingine hii ukitumia mbili itakuwa umekaa naye mpaka hii changari hize. Lakini ile nyingine unaweza tumia hivyo ni 3 hours utasikia imeanza kutoa harufu. Alafu unaitupa.
Rotara says that he and his 2 employees churn out about 100 masks in a day. The Uasin Gishu County Juakali Association has thrown its support behind the innovation.
Tupewe support na serikali ya Uasin Gishu County na serikali yoyote ya county yote na serikali kuu na shirika yoyote yenye inaweza kutupatia msaada hata ya kifedha ili sisi pia tushone hizi kwa wingi ili hizi meski ifikie wananchi wa kawaida.
The Kenya Bureau of Standards is yet to give the green light for the sale of the masks and has warned the tailor against selling them before receiving approval from the relevant government agencies. Gabriel Kudaka, NTV.
From Uasin Gishu County to Machakos, where the Governor Alfred Mutua has urged local researchers to move with speed and find a vaccine for the novel coronavirus instead of waiting for the cure to come from the West.
Kwa wakati wa coronavirus, nyinyi mko wapi? Are you sitting in the labs trying to come up with a cure for coronavirus or a vaccine? Ama mko tu nyumbani? Because we've got very educated people with papers. Wanafunza watu mpaka wanapata PhD. Professor mzima, uko wapi? Where is the solution you're giving to the world?
An armed former General Service Unit police officer, a suspect of Tuesday's car bombing incident in Bungoma town, was shot dead by police officers. The ex-JSU officer had defied a police order to stop and instead he removed a pistol to fire at the officers. Bungoma Police Commander Musyoki Mutungi said police officers had been trailing him since the bombing incident. The ex-officer is also suspected to be the mastermind of a robbery in Nyamachanja estate where a family was robbed and their car bombed using a hand grenade. The police recovered a pistol, his identity card and HIF cards, among other things.
Wananchi wale waliibiwa ama wale waliadhiriwa waliweza kumtambua na tukashirikiana wao tukafuatilia kutoka jana mpaka leo na tumefaulu kupata huyo mwizi na alikuwa na bunduki na alijaribu kupigia askari risasi lakini tukamwangusha.
The government has moved to quell fears among members of the public that the fight against the desert locusts has been neglected. Even as the government focuses more on containing the possible spread of the coronavirus, the training of officials in different counties is still ongoing in a bid to fight the insects.
A second generation of the locust is said to already causing havoc on vegetation in several parts of the country as eggs laid by the first generation have hatched. Speaking in Isiolo during the Desert Locust Master Training Workshop for agricultural officers drawn from 27 affected counties, The Administration Secretary in the State Department of Crop Development, Hassan Akelo, noted that the fight against the insect is still ongoing. The spraying exercise is still on.
Kampeni ya coronavirus haija overshadow locust. Kazi ya locust campaign inaendelea vile mnaona saa hizi hapa. Tunaendelea kupiga na madawa kila pahali. Operation yetu inaendelea kama kawaida.
The training of the officials, which is set to end on 3rd April, is being conducted in 2 shifts to ensure that social distancing is observed. According to Harsama, the Department of Crop Development has made arrangements with the Ministry of Interior and coordination of national government so that the personnel involved in the spraying of desert locusts are not affected by the dusk to dawn curfew that is being implemented.
Sasa sisi tunaomba tu wananchi watupigie ripoti hali wanaona nzige imeonekana, watupatie ripoti. Hata sasa sisi tuna mawasiliano mazuri na wananchi na wakulima wale wanakaa huko mashinani.
The training will also enable the officials to recruit young people from the affected areas and also train them so that the government gets enough workforce to effectively control the locust. The locust has been managed in most of the affected counties with the exception of Isiolo, Samburu, Marsabit and Laikipia, which are still heavily affected. The government has also received 10 vehicles from the Food and Agriculture Organization to help contain the locust. And according to Harsama, the vehicles are equipped with vehicle-mounted sprayers and will be used in areas where use of planes cannot be effective. Halima Gongo, NTV.
Mobile penetration at the end of 2019 stood at 114.8% with 54.5 million active SIM cards in the country, according to the Second Quarter Communications Authority of Kenya's sector statistics from October to December. Safaricom's M-Pesa service continued to dominate the mobile money landscape with a market share of 98.8%. During the period under review, the total number of short messages sent stood at 15.6 billion, down from 17.2 billion posted during the previous quarter. The CA notes that the number of letters sent in the 3-month period increased by 9.7% to 10.5 million, up from 9.6 million sent between July and September. The bump in snail mail is attributed to Kenyans sending success cards to their loved ones. Former Masai President Pape Diop has died, and this is the sports news. I apologize for not introducing it earlier, but has died aged 68 after contracting the coronavirus. Diop, who was born in Chad but had French and Senegalese citizenship, led the club between 2005 and 2009 and helped build the side that lifted the French Premier League title in 2010. He was hospitalized in Senegal after contracting the virus there and became the country's first COVID-19 fatality. Incidentally, he had been poised to be moved to France earlier in the day before his condition deteriorated. Diop was also a journalist and football agent, most notably for legendary footballer Didier Drogba, before taking over the reins at Marseille. FIFA are working on the details of a football Marshall Plan to deal with the financial fallout from the global coronavirus pandemic. According to Reuters, the football world's governing body feels it has a duty to help those in need due to its strong financial situation, with its reserves said to be in the region of $2.7 billion. The exact format and details of their assistance have yet to be decided, but this week we'll see further consultations with FIFA's member associations, the continental confederations and other stakeholders. Most domestic and international football competitions around the world have been suspended due to the pandemic, with clubs taking a financial hit. That's it for NTV at 1. Once we have the Ministry of Health briefing scheduled, it will be brought live on NTV. And until then, NTV Alasiri comes your way at 4 p.m. My name is Olive Burrows.
This is NTV.
I help women find independence by training them in fish farming. It's tough on my back, joints, and can cause headaches. Panadol Extra relieves multiple types of pain. If symptoms persist, seek medical advice. I help women find independence by training them in fish farming. It's tough on my back, joints, and can cause headaches. Panadol Extra relieves multiple types of pain. Panadol Extra, now with new Optizop technology, to fight multiple tough pains with 3 times more pain-relieving medicine in the first 30 minutes when you need it most. Seeing them support themselves makes any pain worth it. If symptoms persist, seek medical advice.
NTV and PesaLink, the most efficient way to send money, have a message for you. We know you need to stay home and stay safe for yourself, the ones you love, and for Kenya. But that does not mean you can't work or do business. Use PesaLink for all your payment and banking needs from the safety of your phone or laptop. Stay safe, stay home. Business goes on with PesaLink.
Working from home? No problem. Fiber Home has you covered with the fastest and most reliable internet speeds. Get connected today. Kazi lazima iendelee.
Molfix breathable surface developed with Airsoft technology is very soft and provides the best Molfix skincare.
I found the best diaper for my baby's sensitive skin.
All babies deserve a high-quality diaper. You should also try Molfix.
I help women find independence by training them in fish farming. It's tough on my back, joints, and can cause headaches. Panadol Extra relieves